Hi everyone. Today we're going to talk about different regions of the brain and how to identify if you have symptoms or patterns of dysfunction in those early areas. So one of the things to really understand is that when you're looking at brain function um, and just your overall health over time, there are some conditions like neurodegenerative diseases that have really clear symptoms, usually with rigidity and stiffness. And then there's some degree of neurodegeneration we all have at different areas of the brain that may not be associated with neurological disease, but it's just a part of aging and part of neurodegeneration. And that can lead to loss of functions. So what I want to do today is kind of teach you what each of these symptoms are, and then also give you some suggestions of what you can do to really activate those areas and to improve them. Before I really get into all that detail and then take questions, let me just go over some basic concepts. And if you can give me about 25 minutes to kind of review these key concepts, and then we can open for questions and go from there. Now, one of the things to really understand about the brain and how it works is you have two things that are involved with your everyday normal brain function. A normal everyday brain function could be your memory, your recall, your focus, your concentration, your balance when you play sports, your motor coordination when you play sports, your ability to perceive sounds, music. Those are all associated with brain function. And one of the key things is, the healthier your brain is, the greater life you have. The greater your brain function is, the more you can enjoy all the things in your life, whether it's the ability to taste food or the ability to dance or move or to recall things and all those things that are involved with it. So when you look at the brain has some very important concepts. One of the concepts is the amount of neurons you have in your brain. So one important thing to understand is you are actually born with all the neurons you will ever get in your life from day one that you are put on the planet. And then from that point on, we do lose neurons. Now, losing neurons and the amount of neurons you have isn't related to function, because if you look at, for example, a newborn, it's not like they have high integrated function, and even though they have all these neurons there, their neurons are not connected. So neurons connecting is really critical, and this is really important for function as well. So when you take someone who, for example, is let's say 10-year-old, they have lots of neurons compared to, let's say, a 60-year-old, which has now less neurons, because over time we do have some degree of neurodegeneration. We lose our total quantity of neurons. If both the 10-year-old and the 60-year-old were trying to learn a new cognitive task, like learning a new language, well, the 10-year-old is going to learn it much faster. If they were both trying to learn a coordinated movement, like a dance step, it's likely that the 10-year-old is going to learn these faster, because they have more neurons, and if there's more neurons, then they can connect to each other, and when neurons connect to each other, they branch into each other. That's when function happens. So the more neurons you have, the easier it is to have neuron connectivity, because they're just closer together. But as you get older, these neurons are spread apart, and when you activate a neuron, the branching that takes place to get that function to then respond is much more difficult. So over a period of time, we can lose function in certain areas of your brain just through neurodegenerative processes. Now, the brain is extremely sensitive to inflammation, oxidative stress. So if you have autoimmune disease, if you have inflammatory bowel condition, if you have an unhealthy diet, if you have anything that basically promotes an inflammatory response, then we know that definitely accelerates brain degeneration. If you combine that with someone who gets hypoxia to the brain, they don't smoke, or they're sedentary, they don't get blood flow to the brain, they don't get enough sleep, that really causes the brain to atrophy. If you add all those other factors, then you have a certain degree of risk factors and variables that then cause someone's brain to basically lose function. Now, another important concept to understand is you're constantly developing your brain throughout your lifespan, and you may have greater connectivity, or we can use the term plasticity being neurons connecting to each other and functioning. You may have greater connectivity or greater plasticity in certain areas of your brain based on what you've been doing in your life. So, for example, if you are a dancer or a gymnast, the areas of your brain that are involved with like balance and coordination and muscle activity are going to have greater connectivity and greater plasticity than someone who doesn't do that. And if you're a mathematician, the areas of your brain, like the left inferior parietal cortex, may be much more developed than someone who has hated math and avoided math their whole life. So when we take a look at, all of us, we all have different degrees of connectivity in different areas of plasticity. than other people based on how active we have been with those regions. So an artist is going to have higher degrees of connectivity in the right parietal, inferior cortex, and so forth. So that's one part of it. Now, the reason that's important is as you get older, the areas of your brain that have less connectivity are going to show up with symptoms first as the brain starts to degenerate. So a great example is like if you, for example, hated math. Like you never liked math. You never wanted to do math. You did everything in your life to try to avoid math since you were in school. And the area of your brain that's involved with that is this area of the brain, the left inferior parietal lobule. That area of the brain then doesn't have as much connectivity. And then as you get older, and let's say you get, I don't know, let's say you get inflammatory bowel disease or celiac disease or something like that, the inflammation is going to speed up neurodegeneration in the brain, but the areas that have the least amount of connectivity are going to start to show up symptoms first. And this is not a neurodegenerative disease. So there's a whole host of people that start to develop all these weird symptoms and all these weird clinical presentations that are not really weird. They're just not a disease. And they walk into the healthcare system and they go see a doctor and say, hey, listen, I have vertigo and I have movement, or I have tinnitus, or I have difficulty finding words, or when I get really tired I can't speak really well, or I notice sometimes I just sway and have to hold on to the handrails when I go down. And they just say, well, you don't have a neurological disease, you did a normal neurological, you have normal neurological exam findings, MRI is normal, there's nothing really wrong with you. You're just getting older, or something like that. But really what it means is you have specific areas of the brain that are neurodegenerating. Now, the same principles, the same regions, I'm going to go over each of the sections of the brain and kind of tell you the symptoms for them and some things you can do with them. These same concepts also apply to not just neurodegeneration, but neurodevelopment. So in a clinical setting, when we go through looking at everyday function and what the patient is able to do, in a neurodegenerative model, you're looking to see what areas are not working and that are lost. But in a neurodevelopment model, where you have a child with a learning disorder or attention deficit disorder or whatever the condition may be, they just aren't able to do some tasks. That also is a clue to us that those areas of the brain are in trouble and need some work. So the information I'll share with you is really important for both neurodevelopment and neurodegeneration patterns, and I'll try to make the link for you with that. So with that background in place, let me get in there and just start to talk about different areas of the brain. Now, let's start with the front of the brain and kind of work our way back, and then I can tell you each of the symptoms and how they all work. So in the very front of your brain, you have your frontal lobule, and your frontal lobule includes your dorsolateral cortex and prefrontal cortex. They're just different names of the brain, but just think of the front of your brain. So the front of your brain is really involved with what's called executive function. So the ability to plan, the ability to organize, the ability to follow through, those are all associated with the frontal lobe. The frontal lobe is also really critical in what's called working memory. And working memory is your ability to hear information and then analyze it and think through it and see if it's accurate or not. And then your ability to recall that within the first couple minutes is your frontal lobe. That's different than your long-term memory. Your long-term memory, we'll talk about later, is your medial temporal lobe. But your frontal lobe is involved with active thinking, planning, organizing, analyzing. And when the frontal lobe is down, it's really common for people to not be able to initiate tasks or to finish tasks. And finishing tasks is nothing more than constant initiation of tasks over and over again. But you'll see that. Now, frontal lobe dysfunctions, when that starts to happen, like let's say it's a neurodegenerative model. In a neurodegenerative model, the frontal lobe happens, people just lose their desire to want to do new things. They are not motivated to do anything. So loss of motivation, loss of initiation, not really caring anymore. Those are all frontal lobe patterns. Some people refer to it as laziness. There's children that have, you see a 30-year-old kid that's never left home and parents are still taking care of them. That could be a frontal lobe developmental disorder. When you see a spouse that just doesn't want to do anything anymore, is depressed and can't function and can't think and can't initiate and really can't perform like they used to, those are patterns of frontal lobe area dysfunctions not working. Attention deficit disorder is a frontal lobe disorder where there just isn't enough brain endurance and brain function to just focus and stay on task. So those are really common. So lots of people start to have frontal lobe degeneration patterns and frontal lobe functions, and no matter what you're doing in your life, whatever your profession is, if your frontal lobe goes down, you're no longer performing. That's one of the key things. Now, the frontal lobe is also involved with, there's different mechanisms of depression, and maybe we should talk about depression at some point in one of these talks, but depression involves different regions of the brain and different neurotransmitters and different responses. But one of the key things with frontal lobe degeneration that then gets expressed and diagnosed as depression is they just can't do anything and don't want to do anything. And many times that's associated with depression, but it's really the frontal lobe not engaging. So why does this happen to some people? Well, again, if they haven't used the frontal lobe or haven't developed the frontal lobe very well, as they go through life and get inflammation, these areas may degenerate, or if they have constant inflammation and underlying mechanisms as they develop, they just may not develop the frontal lobe. But also, another key thing to add into this factor is that some people actually have traumatic brain injuries that they don't know really impacted the brain until years later. So you could have like bumped your head and had something just smash into the front of your head, and you have a little injury to your frontal lobe, and right after that you may have not felt okay for a few hours or a day, but then down the road, a year or two later, even 3 years, 4 years later, you start to have decline there. And one of the things that's interesting about current research is that current research is really showing that when you activate these cells in the brain called microglia from a traumatic brain injury, that sets up a cascade of inflammatory responses, and that cascade of inflammatory responses progresses over a period of time, like a forest fire, just getting bigger, bigger, and bigger, and bigger, and bigger, and then you start to get neurodegeneration in that area of the brain much, much more rapidly from that traumatic injury, but it doesn't really express itself until a few years later. So sometimes, bumps in the head, sports injuries, some falls, whatever the situation may be, can really bring out some of these patterns. So that's the frontal lobe. So I think that's important. Now, when you're looking at frontal lobe dysfunction, when you look at any type of brain degeneration, you got to figure out what the mechanisms are that cause brain degeneration. Blood sugar instability, improper essential fatty acids, and inflamed gut, brain-gut axis issues are all part of it, which I don't have time to get into. But I did do a very thorough review of all the different lifestyle, metabolic, and factors that impact brain function in my book that I wrote, Why Isn't My Brain Working? So if you want to check that out, I give you in that book step-by-step approaches to why the brain starts to degenerate and what lifestyle factors are. In the beginning of each chapter, I give you a list of symptoms so you can see if those symptoms apply to you, and then if they do, then that chapter is really relevant. So you could have, let's say, constantly blood sugar spikes and then hypoglycemia, and your blood sugar level drops, and you get fatigue and crash in the afternoon every day, and then you have to eat to get your function back. Well, that's a neurodegenerative model. So in the brain book I wrote, you'll have a little section there that will go into that. I also created an online program which is called Save Your Brain, and it goes into all those mechanisms as well. And it teaches you step by step how to implement diet, nutrition, lifestyle with videos and workbooks and everything to help your brain recover. So I'm not going to spend time about dietary, nutrition, lifestyle factors that can do that in this talk. I just want to tell you what these different areas of the brain are and then what to do with them. So we talked about the frontal lobe. And the frontal lobe is involved with executive functions, which is memory, recall, planning, coordination, the ability to want to initiate tasks, and the ability to finish tasks. And if this area of the brain is down, then the role in neurological rehabilitation is whatever you can't do, you need to do. So initiating is really, really important. Now, for some people, it's motor initiation. Like if you can't initiate your movements and wanted to exercise and do things, then you probably want to do things like ping pong or play with a ball or play catch and hit against the ball, because that makes you initiate a catch, and the catch it initiate this initiating response, and then responding to it is very good for people that have frontal lobe issues where they have difficulty getting their body moving. And one of the reasons why people don't exercise also is that they have frontal lobe degeneration. They can't get their brain to initiate movement, so they're just sitting all day, and they want to exercise, but they just really can't get up and do it. And that so-called laziness is really frontal lobe. So this is really important. A lot of people that have chronic issues really have brain issues, and they become the mysterious patient, but they're not really mysterious. They just have a pattern people aren't picking up on. Now, the other key thing with frontal lobe issues is just planning and organizing. So anything you can do if your frontal lobe is down to improve planning, improve organizing is going to be supportive to rehabilitate that brain. What will happen with most people is certain areas of the brain will start to degenerate, and then they try to do those tasks, like let's say tasks that involve planning and organizing, and then they just basically fatigue and can't do it, and their brain gets tired, and then they just stop. And that actually is the worst thing you can do. So if your frontal lobe is down, you may want to plan a project and have goals and steps and really just work through it, even though it's hard to do. And the days that it's hard to do, you have to remember you want to do it because it's therapeutic for you. That you actually, when you push yourself, when you activate that frontal lobe and initiate and make that happen, you can really get that area of the brain to start to fire. The reason that's important is when you have neurons that are degenerated. Let's say you have a neuron. Let's say you have 3 neurons, and then this neuron has degenerated. Let's see if I can do it with my fingers. If this neuron is degenerated, these can no longer function. So if this neuron fired to this neuron and this neuron fired to this neuron, but then this neuron's down, then that function is lost. But when you activate neurons, this neuron can branch over this bad one and then reconnect to this other neuron, and then function comes back. So if you do have frontal lobe issues, you do have to really push yourself and plan some more activities and organizations. And when you don't want to do them, push yourself to do them because it'll start activating those regions of the brain. All right, so that's the prefrontal, orbital, frontal area. Now, if we go a little bit further back on the brain on both sides, we have an area called the supplemental motor area. It's also part of the frontal cortex, but it's the motor, and motor means muscle movement. This area here is one on the right and one on the left, and the one on the right controls the left side, the one on the left controls the right side. But if this area of the brain starts to neurodegenerate, whether it's from a past injury or from lack of use or for a combination of different variables, then one of the things that'll happen is there's going to be a tendency to have tightness and heaviness in the opposite limb. So when you look at the brain, the brain has different regions, and they call it a homunculus, or they call it a somatotopic representation, which means like there's areas of your brain in the very midline which control your foot, and there's areas that on the lateral part control your face, and there's areas down the lower part of your frontal motor area that really control your upper extremities and your limb. So you can have injury or degeneration in different areas and have different functions. For some people, let's say if they injure their right superior medial, the top center areas of their premotor cortex, then they may have difficulty with their leg. Like their opposite leg can get really heavy at times, and it gets really tight at times, and they get leg tightness. So a lot of people have, for example, chronic shoulder tightness or chronic hip tightness, and that those areas get really heavy in part of the day, that actually have a brain injury that's caught up with them, or areas of their frontal lobe not working well, it's injured. In a clinical setting, we see that all the time because, well, when you have someone check your deep tendon reflexes, if you've gone to a doctor, if one side's really jumpy and one side isn't, that's a clue to you that this area of the brain may be involved. I mean, there's other things that can do that, but that's one of the things to consider. Excuse me. Okay, so that's the premotor area. And if you have an area of your brain that is like, if you have a limb, like upper extremity or lower limb or lower extremity limb, that at certain times, especially when your brain gets tired, is really heavy, is always getting tight, like a really tight hamstring all the time, always on the right side, or really tight hip flexor, always on the right side, or a really tight shoulder, always on the right side, and it gets tight and it gets heavy, those are signs that the opposite motor strip may not be working. So then what do? Well, what you want to do is, if you have those, you want to do complex motor movements like doing figure eights and different motions with your limb. If it's your leg that gets heavy and tight, just constantly do that every day. That'll start to activate the other area, develop plasticity, develop connectivity. You want to do the same thing if it's your arm. Whatever the limb is, that can be involved with that. So we went to the frontal lobe, which is executive function. We went to the lateral areas, which is involved with your motor coordination, dysfunction that leads to heaviness and dysfunction. And then on the left side of the brain, right here, there's an area called Broca's motor speech areas, and this is the part of the brain that's involved with your muscular ability with your lips and tongues and your voice box to speak, the motor function of speak, not the cognitive function where you think about it, but the actual aspect of speaking with your muscles involved with speech. And for some people, when this left Broca's area starts to become dysfunctional, we'll see that especially when they get tired, they just have a difficult time producing their words. So they have a difficult time producing their words verbally. Sometimes they just go like, I don't even want to talk. Speaking is just difficult. Speaking is exhausting. I don't even want to do it. Or really when the brain gets tired, they'll have a really hard time with pronunciation of words, and their fluency of their speech through their motor pathways, their speech pathways become dysfunctional, so they start maybe slurring their words. As they get a little tired, they may even sound drunk at times if their brain is not working. So there are definitely people that have this area that's dysfunctioning. And then as a clinician, I'll have sometimes patients come in and we'll do a history, and then I can see their brain fail on them right there. They start to lose their fluency, their motor speech fluency becomes compromised, and they get tired, they can't produce words, they're not pronouncing words, and then I ask them, like, is it hard for you to speak now? And they're like, yes. So those are involving what's called the Broca's area, the motor speech areas. And if that's involved, then there's a bunch of speech types of therapies you can do, but the key thing is basically if it's really bad, you can always consult with a speech therapist and kind of go through the exercises. But one of the easy ways is just to go through all the vowels, like o, e, and just say those out loud over and over again, and then try to pronounce each letter of a word out loud and just activate really focused, concentrated speech to really rehabilitate that area. So that's involved with the frontal lobe, Broca's motor area. Okay, so now we talked about the frontal lobe, executive functions, talked about the motor strip, we talked about the speech area. Then if we go a little bit farther back, we have an area of the brain called the parietal lobule. And the parietal lobe has an area called the somatosensory cortex, and soma means muscle, soma means muscles, joints, and ligaments, and sensory means your perception of that. So there's an area of your brain called the parietal lobe that perceives where your opposite limb is, whether it's your arms or legs. This area of the brain, if it starts to degenerate, what will happen is a person will have difficulty at perceiving where their arm or leg is, or one side of their body is to the other side. One of the easiest ways to screen for this is just to close your eyes and just think about, can you feel where your left foot is, and then just really perceive where it is, and then switch to the right side. Can you really feel where the right foot is? Do the same thing with the left hip, right hip. And then do the same thing with your right pointer finger, left pointer finger, elbow, shoulder, and see if you can perceive them being in the same, as easy to perceive where they are. And if you can't, and you go, wow, I can really feel where my left shoulder is, but I'm really having a hard time feeling where my right shoulder is, then that tells you that wherever limb area you can't feel, the opposite side is not doing well. And that's associated with parietal lobular degeneration, parietal lobe injury, and that is going to lead to some things. People that typically end up losing integration of their parietal lobe area that involved with somato sensation, they tend to get injured all the time. So if you for example, can't feel where your left ankle is compared to your right, you're guaranteed to have more ankle sprains on the side of the ankle that you have injuries for. As a matter of fact, when I used to work with a lot of athletes, I would see athletes getting injured always on the same side, always on the same time, spraining the same ankle over and over again. And then we have them close their eyes, and we take a pinwheel, or we take a vibration sensor or tuning fork. You could see that they couldn't perceive things in their injured limb. And actually, the reason they kept getting injured in the same arm, or this same ankle sprain, or this same knee injury, was really because they had some subtle degeneration. With athletes, it was typically from brain injuries that they didn't even know they had, that then impacted their ability to have their body perceive where their limbs are in space. So lots of people have these somatosensory issues. And if you have it, then basically what you do is you think of the area of, if you had difficulty perceiving your right leg compared to your left, then you want to just close your eyes, and every morning you just want to kind of feel where everything is, your big toe, your little toe, your shin, your calf muscle, your knee, and then go start from the toes and go all the way up to the area you're having difficulty with. And then once you perceive where all those are, then perceive if those areas are cold. Start with your toe. Think of your big toe being really, really cold, like ice on it. Do that with every other region of your foot all the way up. And then think of feeling like your toe being really, really hot. And just visualize your toe having some kind of hot pad put on it. I'll start with your toes and go all the way up. And that'll start reactivating that parietal lobe and helping that connectivity and that regeneration. So that's something you can really do at home as well. Okay, so those are the areas that we get that are involved with the front areas. Now we're getting just to the middle areas of the brain as we start to get more posterior. There's an area in the brain called the inferior parietal lobule, And the left side of that left inferior parietal lobule is involved with things like the ability to distinguish left versus right, difficulty with math calculations, difficulty finding words, and difficulty trying to recall specific numbers like a phone number or an address that's basically math related. So this is an area of the brain that's really common to have involvement with, because a lot of people that are, again, like we talked about earlier, bad with math, they don't use these areas of the brain. They kind of avoid them, so they get connectivity and they get some loss there. So if you have constantly difficulty with right-left or so-called right-left confusion, and you have a really hard time with calculating numerical calculations, and you have a really hard time with remembering phone numbers or numbers, then that tells you that this area of the brain is not working. And if this area of the brain is not working, the best thing you can do is to open up your phone and try to memorize your most important phone numbers and be able to recall it. Start playing with apps that involve mathematics. Maybe it's a basic, elementary math course where you do basic multiplication and division. But that's an important area. If that area of the brain continues to degenerate, you're going to have a really hard time functioning when it comes to anything associated with numbers and right-left discrimination. There's also apps that help you with right-left confusion that are out there. There's one app called Orientate, Orientat, and that shows you a bunch of images of a right arm or left arm in different positions, like a picture of this, and then like a picture of that, and a picture of a foot. And you have to click, do you think it's right or do you think it's left? Do you think it's right? Do you think it's left? And then you can go through that and then see what your score is, because after you finish those tasks, you'll get a score of how accurate you were, and then you can kind of compare yourself over time, and as your brain starts to develop, you'll be able to make some changes there. Now, on the right inferior parietal lobule, that's your area of your brain that's involved with recognizing shapes, recognizing pathways like directions. So people that lose their right inferior parietal lobule, they have a really hard time recognizing shapes, and they have a really hard time with remembering different images. So it's really more of an image issue than a right. One of the easiest ways to see if this part of your brain's not working is to take like a magazine or with pictures of celebrities or people that most people know, like world leaders and so forth, and then just turn it upside down and see if you can still recognize the person's face. Like, let's say you take a picture of, let's say, movie star, like let's say Tom Cruise. Most people will see him and recognize him. However, some people, if you put it upside down and you just start with the upside down image, they won't be able to recognize who that is. Those are signs that the right inferior parietal cortex is not working. And if that's the case, then one of the best things you can do is to do jigsaw puzzles, play with jigsaw puzzles. And playing with jigsaw puzzles will really help develop that right inferior parietal lobule. And you want to start with maybe a 200 set one versus a 10,000 set one, and then kind of work your way up. And then at some point, if the jigsaw puzzles get easy, then what you can do is just turn it over so there is no image, and you're just totally based on using shapes to figure out how things work. And that'll be very therapeutic for that area of the brain. Now, as we go into the brain and get further back, and then you get into the areas kind of really by your ear, and then this is where you have an area called the temporal lobe, and the temporal lobe is involved with many functions, but the key area that I want to talk about is the auditory cortex. And the auditory cortex is your ability to perceive sound and to distinguish sounds at different frequencies. When this area of the brain is starting to generate and not functioning well, what happens with people is they have the difficulty distinguishing any kind of sound if there's any background noise. So if there's any background noise, someone may not even understand what you're saying to them. They have to actually follow and stare at your lips to try to figure out what you're saying. And also, if this area of the brain starts to get degenerate, starts to have degeneration, one of the other key things that'll happen is you just can't get rhythms out of your head. Now, we all hear a rhythm here and there, and then we just can't get out of our head, whether it's a song or some kind of melody. But people that start to get degeneration here, that happens all the time. They constantly have this rhythm in their head. They can't get it out, and that's a red palm. That's a red flag for degeneration there. So occasional is okay, but if it's happening all the time, like every week, every day, then that's a red flag. Another key thing with this medial temporal lobe is when it starts to degenerate, people start to develop tinnitus. And tinnitus, or some people call tinnitus, but tinnitus can happen with medial lobe degeneration, but it's not the most common cause. The most common cause is that you actually get injury to the receptors in the ear that are involved with perceiving sound. But unrelated to the damage to the receptors, you can get it from temporal lobe degeneration. So people that have temporal lobe issues really have a hard time with sound discrimination. And the most common thing is when there's scattered background noise, they can't hear conversations. If that's happening to you, then there's some things you should do to rebuild that. And the best thing you can do to rebuild this area is to listen to a song you like and determine if you can pick up, let's say you want to pick some music that has multiple instruments and let's say someone's voice. So maybe you just want to focus on listening to the guitar. Then you want to just focus on listening to the drums. And then you just focus on listening to the voice. And as you go through different instruments and you really have concentrated effort and focus, and if you can do that with a couple songs a day, that can be very therapeutic to start to reestablish that temporal lobe area. Okay. The other key thing the other area of the brain that's really important and one of the most common areas of neurodegeneration is an area of the brain. It's in the temporal area, but it's like really deep inside the brain. It's in the very middle areas of the brain. They call it the medial temporal lobe. And the medial temporal lobe is involved with regeneration of actually, it's involved with degeneration associated with Alzheimer's disease and dementia. The medial temporal lobe is the area of the brain that is involved with recall of memories and long-term recall. So remember, there's two types of memory. One's called working memory. When you hear something, you process it, and you can recall it right away within the first minute. But if you have to recall an event that happened 5 years ago, or even 2 weeks ago, if you have to remember what you ate for lunch 2 days ago, that's the medial temporal lobe. And the key thing with the medial temporal lobe is also the right medial temporal lobe is involved with your sense of direction. So if you always have to use a navigation system and it's getting to the point where you have to depend on a navigation system to get anywhere, that's a sign of right medial lobe degeneration. And then signs of left medial lobe degeneration is you can't recall numbers and facts. That's different than the parietal inferior lobule, where you just can't do math. But the ability to recall numbers is very significant with the left side. So the medial temporal lobe is really one of the things we all have to be concerned about, because as we get older, just age itself is a risk factor for developing Alzheimer's or dementia. So one of the things to remember is that if you're noticing like you walk into rooms and you forget why you're there, if you can't remember events, if you can't remember where you put anything, and it's getting worse and worse, and you have to use stickies and notes to put everything everywhere, that's a sign of medial lobe degeneration, and that is an early sign of dementia. So that's one thing to be aware of. Okay, now as we get to the back of the brain, then you have the area called the, oh, by the way, if your medial temporal lobe is not working well, you have to do memory and recall. Like you may want to, if you have a hard time with directions, you may want to actually visualize how you got to that place and then work your way backwards every single day. So if you leave your house and you have some kind of pathway or route that you went through to get to your event, if you can recall that and then work your way to there and work your way back, that'll help the right side. If you are having a hard time with events, then be aware of that. So the medial temporal lobe is deep inside. It's not outside. It's deep inside. I'm touching my hand out here, but that's the lateral lobe. You really want to think about it. It's in the very inner side of the brain, middle side of the brain. Okay, so then you look at the occipital lobe. The occipital lobe is in the back of the brain, and the occipital lobe is really involved with perceptions of colors. And one of the key things you can tell if your occipital lobe is off is, and usually one side is degenerating at a different rate than the other side if it's starting to be a problem. You can take it like a really colorful image with lots of different colors on it, then close one eye and look at it, and then close the other eye and look at it. And if it's brighter, much more brighter on one side, and you can distinguish colors more, then that tells you that the side of dullness, like if things were duller with your right eye, that tells you that left occipital lobe may not be working as well or starting to show early signs of degeneration. And in those cases, what you want to do is you want to look at color images like red, blue, yellow, red, and then see the image and then close your eyes and then try to visualize that image and that color in your head, and then go to the next color and go to the next color and go to the next color. And if you can do that over and over again, that can help rehabilitate the occipital lobe. And then finally, we get to the parts of the brain in the very bottom called the cerebellum, and the cerebellum is controlled with balance. And when people have cerebellar issues, they notice that their balance and instability is worse when they close their eyes. If you close your eyes and stand with your feet together, you shouldn't sway. But if the cerebellum is starting to degenerate, when you close your eyes, like you may be rocking all over the place, or you may even fall. And if you notice, like you have to use handrails to walk down steps, those are all associated with the cerebellum. And in those cases, if you have issues with the cerebellum, and this is one area of the brain called midline cerebellum, you basically just want to do balance exercises. You want to focus on standing on one foot, standing on the other foot. You can use like a wobble board and stand on that if you're watching TV or whatever you're doing. If you work out and exercise, you want to make sure like you use something like a Bosu ball, an even plane when you do some of your exercises to help with your stability. But this is really balance rehab will be critical. Like when your balance goes down, that's telling you that your brain is degenerating in that area. It doesn't mean you just have a personality of bad balance. That means there's an area of your brain that's starting to degenerate. Now, the cerebellum area of the brain has a midline area, which we talked about, but then it goes to a lateral area, and the lateral area is involved with hand coordination and smoothness. One of the ways you can check to see if that's okay is just try to touch your nose. And if your cerebellum is working, the movement is very smooth. If your cerebellum isn't working, what you'll notice is right before you get to it, you get a little shake. And that's called a termination tremor. So normally it should be very smooth. So if you get a little shake, that's a termination tremor. And sometimes instead of doing your nose, you can just like try to touch a target. So if you touch a target, it should be very smooth. But if you get to the target and you start to shake like that, that's a sign that that area of the brain's not working well. And in those cases, you want to do focused, smooth targeting to start to rebuild that area of the brain. And then there's areas of the brain that are involved with the basal ganglia, and the basal ganglia really can degenerate. It's very common to be involved with strokes, and people have little mini strokes, and they get, for example, chronic anxiety disorders or movement disorders. But that area of the brain is beyond the context of this talk. So those are the main regions of the brain, and people that I'll take it up to questions here, but at least I cover the brain from the front to the back. So front, executive function, planning, organizing, initiating, and this area of the brain is not working. You think of laziness, the motor strip area that's involved with how you have tightness and rigidity and tone on the opposite side of the body, the parietal lobe where you perceive the opposite side of the limb, and then you have the inferior parietal lobule. Left side's for math, right side is for images and shapes. And then you get to the temporal lobe, which is involved with perceiving sounds and discriminating sounds. And then you get into the occipital lobe, which you have color perception. And then you get the cerebellum, which is involved with balance. So those are the key things. And the point I just want to emphasize here is that these areas of the brain can degenerate, completely impact your quality of life, but they're not necessarily a neurological disease. So they're just a neurodegenerative process. And we're all prone to having some degree of this. And the key thing is once you identify it, you really want to do activities that build it up. You want to, it's like having a weak muscle. If you have a weak muscle, you want to try to improve it by strengthening it. So let me see, we'll get into some questions here. And by the way, a lot of these neurodegenerative changes that take place, they're not going to show up on an MRI. MRI, you have to have significant injury to the neuron. You have to lose myelin. You have to, hi, my wife. Dr. Reyes helping me with questions.
I am. Dr. Reyes was downstairs doing neurological exams on herself. Oh, good. Sorry.
I know when you kind of if you're hearing this stuff, you want to examine yourself and see what's happening. And if you do have something that's off, just know it's normal. And the good thing is that you can build it. Now, I should add one other thing. If you have things off and you should see signs of early neurodegeneration, you really want to, this is not meant to be a plug, but I guess it is. You really want to look at dietary, nutrition, and lifestyle factors that cause that. And I go into that with great detail in my book. And maybe through some of these talks, we can cover different parts of that and different concepts of that. And if you really need more help and you can't find anyone to help you, please check out the Save Your Brain program. That really gets into how to evaluate your diet, nutrition, and lifestyle factors that promote neurodegeneration. The goal of this one is just to help identify what your neurodegeneration pathways are, and then you want to do things to activate it. And by the way, the other key thing to understand with the brain is you can't get these areas of the brain to work better by taking a supplement alone. These areas of the brain have to have neurons fire and connect to each other. Just like if you wanted to build your muscles, you can't just take a supplement to build your muscles. You're going to actually have to move your muscles to build muscle mass and strength and muscle endurance. Nutrition can impact your ability to build muscle if you're trying to work out and get in better shape, but nutrition alone is not going to cause you to build muscle. It's the same thing with brain function and neuron activity in the brain. Nutrition can impact how effective you are with responding to your exercises, whether you're doing body perception or you're doing word recall or whatever it may be. But you have to actually do those tasks to get that area of the brain to work. Okay, any questions?
Lots of questions.
Lots of questions.
Okay, so you kind of just addressed one about what are the. Can you please go over nutrition/supplements for certain brain regions? A lot of people are asking that.
Okay, I can try to do it really quickly. I talk about this in the book, but the frontal lobe is really involved mostly with catecholamines. Catecholamines, this is why people drink a lot of coffee, for example, when they can't think and focus and concentrate. Catecholamines are things called epinephrine and norepinephrine. They're the main neurotransmitter involved with focus, attention, and concentration. It's also why they give it like ADD kids Adderall or really high stimulants, because it causes activation of that brain region. Guarana is a really good way to activate that area of the brain. Also, just coffee itself. Coffee has been shown to, people give coffee a lot of bad rap and tea a lot of bad rap, but coffee and tea have been shown to activate catecholamines that really support focus and concentration, and they have lots of flavonoids that help protect the brain. So what they find is that coffee and tea drinkers really have decreased rates of Parkinson's disease and dementia and different neurodegenerative diseases compared to people that don't drink them. The only concern is you probably don't want to drink a lot of coffee or tea if you have high blood pressure, for example. But the coffee, tea, guarana extract, they help the frontal lobe. When you get to the medial temporal lobe, that's an acetylcholine pathway. Acetylcholine pathway, things that help that, or things, one of the best things you can take is huperzine. Huperzine is a natural plant product. It's called an acetylcholine esterase inhibitor. It allows acetylcholine to hang out in the synaptic cleft. So if you have recall issues, that could be very useful. And then the rest of the brain really is not rich in a specific neurotransmitter. They're kind of all involved, so it's not a specific. But the frontal lobe is definitely catecholamines, which is with focus, attention, and concentration, and the medial temporal lobe is really with acetylcholine, and huperzine is one of the best things for acetylcholine. Okay.
Okay, a couple people were asking if you could go over stuff about the basal ganglia.
The basic ganglia has a direct pathway and an indirect pathway. The direct pathway amplifies your movements. So if you see someone that's slowing and moving and everything is slower and they can't move things as well or they're getting rigidity, that's a sign that the basic ganglia is not working. And actually research, and this is important for early Parkinson's disease development, is that it's this part of the brain first. And researchers are finding explosive, fast movements really help regenerate that area and rebuild that area. And boxing, for example, is one of the things they found very effective with people that do Parkinson's disease. Not boxing in a ring where they're hitting each other and getting more brain injury, but just hitting a heavy bag and just hitting focus mitts. And that burst activity, constantly moving, very fast, rapid, coordinated movements help that basic ganglia direct pathway. The basic ganglia indirect pathway is involved with dampening inputs to the brain, to an area called the thalamus. And that area of the brain is actually, I guess you can say GABA can help that pathway. That's another neurotransmitter pathway. So things like valerian root extract, hops, kava kava, those things activate GABA receptors. That can be useful for people that have lots of anxiety and disorders. But it's more complicated than that.
In regards to pandas, you might need to do a talk on that.
Yeah, pandas will have to be a specific talk. We can do one on pandas in the future. Okay. I do need your help with suggestions. I think we booked the next 3 topics based on emails from the last talk.
Yeah,
so,
it's fantastic.
So thank you for contributing and thank you for participating.
Yeah. So one more area that people were asking if you could cover was hippocampal degeneration.
Right. So hippocampal, everything I talked about when I said medial temporal lobe, and I think I kept touching the outside of my head, but it's the medial temporal lobe. The medial temporal lobe has an area of the brain called the hippocampus, and hippocampus means horse in Latin. And if you look at slices of the brain, you can see it kind of looks like a seahorse. So that's where the name comes from. But hippocampus and medial temporal lobe are the same, and they're involved with declarative memory or long-term memory, events, that happen in your life, those are involved with that area of the brain.
Okay. A few people are you ready for the next question?
Yeah.
Okay. So a few people are asking, what are your thoughts on SPECT scans, and are they useful compared to MRIs or ultrasounds, or maybe say what a SPECT scan is, and then.
Sure. So you can do a SPECT scan to kind of get activity, to measure like different activities in the brain. There's lots of conclusions made with them. There's some centers that offer SPECT scan analysis, and they give these beautiful reports of how they look like. I don't know how accurate that is, to be honest with you. They're just like in-house studies, and you kind of see the treatment applications when people go to these clinics to get these SPECT scans sent for them. And they basically get put on multiple neurotransmitters, pretty much every supplement for the brain. It's not very targeted specific response. So I'm not so convinced about SPECT scans as it relates to function. I mean, of course, it's very useful for certain diseases and so forth, but I'm very wary of that. And then when you look at other imaging studies, for these subtle neurodegenerative changes, they're not going to change anatomy enough to change an MRI or CT scan. And this is why the symptom and exam findings are really the only way to find these subtle neurodegenerative patterns first.
Okay. Everyone's asking, what about anxiety in kids? Is there a specific area in the brain linked to anxiety? It just is general anxiety.
Yeah.
I didn't get that. So
if you're experiencing a symptom, it's always an area of the brain that's involved. Anxiety can be from metabolic pathways, or it could be brain-based. The basal ganglia indirect pathway dampens pathways that cause anxiety, and this is where people use like things I talked about, like kava kava, valerian root, hops, passion flower extract. Those things all have GABA agonistic responses. Those natural compounds have agonist binding compounds that then improves anxiety by activating that basal ganglia indirect pathway. But a lot of times what happens, especially in kids, is the basal ganglia indirect pathway that dampens anxiety is activated by the frontal lobe. So it's really more of a focus, attention, concentration issue. And if you activate that frontal lobe, that feeds into that basal ganglia indirect pathway, and then you can see if that helps. This is the problem with a talk like this, because it can get complicated pretty quick, and I really don't want to lose people when it gets too complicated.
Okay. Margaret's saying, what about neurofeedback? What's your impression of neurofeedback?
So neurofeedback can be very helpful for many people, but it's not going to impact all regions of the brain. Like if you have a cerebellum degenerative disease, neurofeedback's not going to do much. If you're having associations with responding and frontal lobe integration with other areas of your brain, it can be very, very beneficial. The key thing to remember is that there's different things that impact the brain differently. So neurofeedback is really good with frontal lobe initiation, activation with other regions of the brain. And if you have a frontal lobe injury or areas where you have association dysfunctions with the frontal lobe, that can be very helpful. But for example, if you have temporal lobe neurodegeneration and you're having difficulty perceiving sounds, that's not going to help much. If you have cerebellar degeneration, where you're having balance issues and coordination issues and tremor, that's not going to help much. So different things will help. Like for some people, they do yoga, and they say things like in the medical history, yoga saved my life. I was never back to normal until I did yoga. And typically you'll do an exam with them and start to see, wow, they have some massive cerebellar degeneration. This is probably very therapeutic for them. Someone else may notice they do not neurofeedback, but they do aromatherapy. And aromatherapy activates a very specific pathway through the olfactory stimulate pathways to areas of the temporal lobe that are involved with olfaction and sense perception. And let's say that area of the brain was degenerated, so they do essential oils and smell these things and go, wow, my brain is back, I can think again, I can focus, this is amazing. But that could have been specific to them. So what you have to understand is whether you do balance exercises, whether you do neurofeedback, it really depends on what area of your brain needs that activation. And for people that find that the right fit for them, they'll have some tremendous responses. So that's what you have to understand about brain therapy. It's really specific to the region and what's involved.
Right. This is just really funny. Michael said, when you're talking about your book, Michael says, I've got the book, now I need the motivation to set time aside.
Frontal
Is that
lobe.
frontal lobe?
Yes, that's frontal
Michael.
lobe. Actually, Michael,
People are
thank you
cracking up.
for saying that, because the first online program I ever did was because I wrote the brain book, and once the brain book was published, people go like, "This is a great book. I read it cover to cover. I don't remember anything, and I don't know what to start with, but I need help." And that's why we created the Save Your Brain Online program, to actually walk people step by step through, like the goals with the workbook and strategies to help translate all the information in the book into workable steps. So you may want to, that might be something you might want to check out.
That's pretty funny. Okay. Rajenda is asking, what part, if any, of the brain is affected by gluten ataxia, and how
Yes.
can you reduce symptoms?
Yes, gluten ataxia is specific to an area of the brain called the cerebellum, and what's happened is that gluten proteins have what they call molecular mimicry, amino acid similar homology, with a part of the cerebellum called GAD65, and when people have gluten sensitivity, gluten issues, many times they'll end up with midline cerebellum degeneration, which means they have balance issues, and they close their eyes, they're all over the place. And for them, they need to get off gluten for sure, and they definitely need to start doing some balance and stability exercises to activate and build plasticity in that area of the brain. And I actually just recently published a case report in the journal Reports about a patient with gluten ataxia and how we recover them. Maybe we can put a link onto it somewhere. But
Okay. Meredith, is focal dystonia a result of neurodegeneration?
not necessarily. Focal dystonia means you have a specific area or a limb that has abnormal muscle tone, so it's kind of stuck in a posture. So focal dystonia in the movement disorders literature is associated with lack of homunculus integration, meaning there's an area of your brain that's involved with that limb part in your parietal lobe, in your basal ganglia, in your cerebellum, in your motor strip that is not connecting and coordinating. And that's what focal dystonia comes from. So it's impossible to tell you what to do with focal dystonia as a general concept. That this really involves high-level neurological examination and rehabilitation to start working with that. So people that do functional neurology or people that do functional neurology rehabilitation would be people that might be able to help you with that.
Sorry, which paper do you want posted? Susan's asking.
It's a paper called...
A case study?
It's a case study on gluten ataxia.
Case study on gluten ataxia. Thank you.
Thank you.
Sorry. There's a lot of questions. It's really good. Is the Save the Brain program for practitioners and or general public?
The Save Your Brain program is for the general public.
Practitioners can use it.
Practitioners can all improve their brain function, right?
You say that in your
Well,
courses.
yeah, it's true. One of the things I always mention to practitioners when I teach them seminars, I say you have two really important clinical goals if you want to help your patients the best you can and to preserve your career. One is to learn as much information as you can and know how to apply it to your patients. And the second one is to preserve your own brain function. I used to travel and do 80 events a year, and I did that for over 10 years all over the country, and even international. And I would go to Denver, Colorado 3 times a year, and I would go to different cities multiple times a year. And when you do that, I would have people that would follow my seminars all the time, different doctors, different practitioners, and when you see them periodically, you can see their decline. So I used to see these practitioners all the time, and you could see their brain was neurodegenerating, and then they just were very frustrated. They didn't know they were neurodegenerating, and their practice was impacted in such a devastating way. So all of us, whether we're doctors, practitioners, healthcare providers, doesn't really matter what your profession is. Your ability to maintain that skill is really related to your brain function. So it's important to sometimes take a step back and focus on what do I really need to do to improve my brain health, to maintain your career and to be functioning at the highest level in your career.
Okay. Martise, what part of the brain causes a voice condition called spasmodic dysphonia, and how can you treat it and recover?
Right. Spasmodic dysphonia involves, again, homuncular distributions with the frontal lobe. It's like a movement disorder. The frontal lobe motor initiation centers in a cerebellum and basal ganglia, specific to muscle pathways that are involved with vocal tone. So again, that is I can't tell you what to do with it because that would really involve doing an exam and seeing what areas of the brain are involved with that. By the way, our practice is really overwhelmed. So We don't have the ability to see any new patients for some time now. Um, but we do have a list of really great practitioners on our website, Dr. K News, practitioner locator for people that have trained with me at the Kharrazian Institute, where I've taught people a lot of these concepts that are healthcare professionals.
Okay. A lot of people are asking, does Hashimoto's affect one particular area of the brain or all areas?
Yes, Hashimoto's will impact all areas of the brain because it's an autoimmune disease. It's really inflammatory, but it has a specific affinity to the cerebellum also because thyroid antibodies, TPO antibodies, bind to cerebellum astrocytes. They cause cross-reactivity. So people that have Hashimoto's are more prone to have cerebellar degenerative diseases, which means their balance and coordination centers of the brain start to degenerate faster. As a matter of fact, with every single patient that I evaluate that has Hashimoto's, I do a really, really thorough cerebellar exam with them. And if you want to know what a cerebellar exam is if you've ever seen a DUI exam, that's actually a cerebellar exam, where they have you walk in a straight line, have you close your eyes and see if you sway or fall, have you touch your nose, and you can run through that. One of the easiest things is, again, close your eyes, put your feet, first close your eyes and see if you sway. And you should everyone will sway a little bit.
Make sure there's someone standing next to them if they think they have an
Yes,
issue.
make sure someone's next to you or you're not going to fall. But you want to look at your sway, put one foot in front of the other. That's actually the better way to do it. And then close your eyes and see if you sway all over the place or if you just can't keep that position. And then really the best test is to see if you can walk in a straight line for at least 3 or more steps without falling. So if you can close your eyes and just start walking like you're on a tightrope, and just walk, boom, boom, boom. If you can do that without having your arms all over the place and you're shaking, you can just do it walk, 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 no problem. That's good. If you can't do that, that's a sign that midline cerebellum as well. If you have Hashimoto's, you should definitely do that test. And if you have some problems there, you definitely want to focus on. Make sure you're definitely not gluten sensitive because that's also a cross-reactive part of that brain, and you really want to do some balance and stability exercises.
Okay, this is a common question. How much time would you spend during rehab activities each day?
So when you're trying to rehabilitate your brain, the key thing is you should never feel worse afterwards. So this is a really great question. Mm-hmm. When you rehabilitate your brain, it's not the same thing as doing cardiovascular workout. Cardiovascular workout, you're trying to push your cardiovascular system to the point you get exhausted, and then you recover, and then your cardiovascular system rebuilds. With brain exercises, you never want to get to the point you totally exhaust the brain. You always want to try to get as much as you can before the brain gets fatigued. So typically what happens is if you do the exercises at a point where it doesn't cause you to get tired and feel worse, but you can repeat that several times a day. So usually it's short duration, not for a very long period of time. And how you know what the right time is that if you do too much of it, you just feel worse or you have a harder time doing the task. So if you, for example, have issues with your parietal lobe and you can't feel where your right foot is, if you keep focusing on it, it just gets harder and harder to find out where your right foot is. That means your brain's fatiguing. So you're doing too much. So the goal is to try to get to the point where you don't get worse at whatever your task is that you're trying to do, and then you repeat that multiple times throughout the day. The more frequently you repeat it, the more these neurons are branching into each other. So the quicker your results will express themselves.
Okay. Someone is asking, why? Hold on. Sorry. So people are asking about, does lion's mane mushroom help with
Does what?
Lion's mane mushrooms?
I'm not sure about lion's mane mushrooms and neurodegeneration, but the key thing is it's not one. There isn't one supplement that just is like the home run for neurodegeneration. You can make some arguments like you should probably have high amounts of glutathione to protect neurodegeneration and a good antioxidant. You can say taking lots of antioxidant flavonoids, things like turmeric, resveratrol, things like fish oils can provide some general good anti-inflammatory response. It's important for the brain, but there isn't one blockbuster supplement. And once again, I try to review all the major ones in the brain book if it's helpful to you. So you may want to use huperzine for people that have memory and recall issues. You might want to use more green tea flavonoids for people that have frontal lobe issues because of green tea also has some caffeine and huperzine also has antioxidant properties but it helps acetylcholine. but those are just fine-tuning some things. Generally, it's just anything that's anti-inflammatory is the general concept. But I'm not sure about the herb you're mentioning.
Okay, so does hypoglycemia impact the weak areas of your brain first?
Yes.
Okay.
Whatever of your brain is not working, when there's decreased feel, those symptoms show up first. So, for example, for some people that have really degenerative auditory areas of their brain, their temporal cortex, they get hypoglycemia. Their tinnitus comes out, and they just can't hear. They can't hear anyone speak unless they stare at their lips. So when your blood sugar levels get low, your weaknesses will definitely come out. And also, your weaknesses will come out if you're really tired. So if you had enough sleep or at the end of the day, your weak areas of your brain will definitely present themselves. When you're well rested and have healthy blood sugar, it's really hard to find them. So know that endurance and blood sugar have an impact on bringing out these weaknesses if you're looking at them.
Okay, Elizabeth's asking, eye movement therapy, does it help with the brain?
Yes, eye movement therapy definitely helps with the brain. Different eye movements have different functions. So like quick rapid eye movements are called saccades. They activate the frontal eye fields in a certain area of the brain. Pursuits and tracking stimulate the cerebellum. Different areas activate different regions. But eye movements are definitely a way to rehabilitate the brain. In Ayurvedic medicine, there are some amazing exercises people do with meditation where they look at all different fields and move their eyes all over the place, and those things have tremendous benefits for the brain. So eye movements require multiple regions of the brain to activate and fire, so they're great. In a clinical setting, you can be very specific and go, I just want you to do slow pursuits down to this angle and only do that for a while. But even just general rapid eye movements in all directions, in all fields, slow movement, slow tracking, can be very, very beneficial for the brain.
Okay, what area of the brain is for swallowing?
What area of the brain is for swallowing? So swallowing is a motor response. So that involves the thought of actually initiating the swallowing is your prefrontal cortex, and the action of actually swallowing is your motor strip. So it's your motor function. So it's the front areas of your brain. And if you have difficulty with swallowing, then guess what? Whatever you're bad at is what you do. So you may want to look at some of those. Dysphagia, there's a dysphagia society that has a bunch of exercises helping with swallowing. If you look up American Dysphagia Association, or I'm not sure if that's the name, but if you Google that, you'll see exercises for dysphagia that can be useful.
Okay, Sean, what leads to hypothalamus atrophy, and what part of the brain areas you discussed relate to that region? Hypothalamus atrophy.
Hypothalamus atrophy is very rare. The hypothalamus is constantly active, constantly moving. It's in the very middle center of your brain. It's very unlikely to get injured. If you get hypothalamus injury, you're going to have to look at genetic mechanisms or some kind of abnormal development. It's not a typical area for degeneration. So I would immediately think of genetic issues that put the person at risk. The areas of the brain you use all the time and active and constant and are very midline, right in the center of your brain, that are not prone to getting impacted and getting injuries on it, are very hard to degenerate. And the hypothalamus is like midline as much as you can be and constantly active. So there's got to be other things involved. That's the best I can answer your question.
Okay, Min, how about substance abuse and addiction? Is that a frontal lobe issue?
Substance abuse and addiction disrupt dopamine receptors. And they actually have been shown to completely change how those dopamine receptors function. And even when people go off those substance abuses, those receptor sites are permanently changed. So some people have ongoing, like their drug abuse, substance abuse, totally changed their dopamine receptors in their brain, and then doesn't come back. So then they have ongoing issues with dopamine receptor efficiency. I mean, the brain has some resiliency, but some things are extreme to the brain, and it's not going to function at the same level. So dopamine receptors are involved with different regions throughout the brain. So it's not one lobe; it's really more the receptor, and dopamine receptors are found all throughout the brain. So.
Okay, so a couple more good ones. Sharon, does the keto diet, intermittent fasting, work on more than one area of the brain than others?
Yes. So when people go into ketosis from a ketogenic diet or intermittent fasting, one of the great things that happens is the body starts to use ketones for energy versus sugar. And ketones are a very efficient source of fuel for the energy powerhouse of the cells called the mitochondria. So you can really have greater endurance and more efficiency with your general brain functions throughout your brain, but it's not specific to any region of the brain. And then ketones have been shown to have anti-inflammatory component of the brain, which is very good for slowing down neurodegenerative diseases. And it also like kind of takes the fire away from the brain. Some people notice the brain fog goes away when they get the ketogenic diet, and they can think clearly because of the anti-inflammatory effects. And also, when people get into long-term fasting states, like even when they do intermittent fasting past the 12-hour window, there's a mechanism called autophagy that gets activated, and autophagy gets rid of like debris in your brain. So we all have some degree of dead neurons that are getting in the way of healthy synapses. We have some proteins that are getting clustered together in the brain called protein aggregates. And when people get into an intermittent fasting phase for more than 12 hours, that autophagy turns on, and they start clearing out that debris.
Okay, Heidi and other people are asking, what is going on when I can stay on task better if I'm listening to an audiobook or a podcast or music? What's happening? What is that?
There are some people that need multiple stimuli to turn on their brain. It's a phenomenon that they've looked at with learning. Like some people can't, if they sit in a room that's quiet, they will go crazy because their mind is all over the place. And they need multiple, like they need to have something on as they study and do for it. I don't know why that is, to be honest with you, but I know it's very unique to some individuals. And the interesting thing about the brain is everyone's brain is so unique and different. So whatever works for you would be great. So I'm not concerned, like I wouldn't hear that and be worried about, oh my God, you're in trouble. It'd just be, that's your unique response. Some people learn differently. That's just the way we're wired.
Yeah. Okay. Is there a test for dementia?
Is there a test for dementia? So dementia is primarily diagnosed by, the early signs of dementia are primarily diagnosed from history and symptoms. And then they can do things like a mini mental status exam, or they can do cognitive testing, which is a bunch of questions you may want to recall, or they have you like count backward from 7 and see if you can count that. They give you like 5 words that you're supposed to remember, and then they have you think about other things and see if you can remember those 5 words later in the history. So they do, cognitive assessments like that to kind of determine if dementia exists. That in combination with someone just saying, I can't remember like how to drive home, I can't remember anyone's name anymore, or have a hard time with it. Those are the key things that happen with it. There are specialized research studies where they're finding these plaques with specialized imaging studies to help identify these later, but they're not commercially available yet. If it gets really bad, they can look at the size of the hippocampus, and they can see some atrophy of that hippocampus area with imaging studies compared to people the same age. That could be a clue. So it's not one test. Like you don't do one test and go, you have dementia. It's really a cluster of history, exam findings, cognitive testing, maybe some imaging that all create the picture of add to the diagnostic criteria of dementia.
Yeah. Okay, Dr. Roche, do you have a favorite functional neurology book that you can share? I have your book and love it.
I would tell you I don't like any of. There's a couple one functionality book out there. It's so outdated. The information is terrible. The references they use are wrong references. I think it's a total mess. So if you see a textbook called Functionality, it's a total mess. If you want to learn functionality really well, we do have a course called Functional Neurology Seminars. I did it with my friend Dr. Brandon Brock. And we went through a 10-module series where we teach people how to evaluate the brain and rehabilitate them. It's for healthcare professionals.
It's for healthcare
professionals. I mean, it's thick, complex neurology.
Yeah.
If you're interested in that, check out Functional Neurology Seminars. And I would say if you print out all the notes, you would have one of the most updated books with all the updated references for it. That might be your best book. And if you print out there's 10 modules. Each module is probably 400 or 500 pages. So,
yeah.
That would be what I would recommend.
Okay.
Let's take one last question and then we have to stop. Make it a good one.
That was a good. Hold on. Let me. To stop. Okay.
Oh, by the way, thank you, Susan, for posting the paper. It's just
Yes.
nice. Thank you. No one cares about it, but when you publish a paper, you hope someone actually reads it. So it's an attempt to have someone look at it.
Oh, okay. This is from Dana. I understand you are planning to publish a new book.
Yes.
When will it be available?
Well, I personally suffer from frontal lobe finishing task issues.
You're very busy.
No, I'm just joking. It's a complex work. We're hoping, we're working on a book. We're working on 2 books simultaneously. One updated on Hashimoto's and one on gastrointestinal disorders. We just finished the first draft to talk about gastrointestinal disorders. By the time we finalize it and get it through, and I don't know how long it takes. So hopefully 2021 is our goal for at least the GI book, gastrointestinal book, and then hopefully 2021, 2022 for the Hashimoto's book, most likely 2022, but hopefully 2021. So we're working on it, and thank you for asking.
Okay, this isn't a question. This is just kind of
Yeah.
a lot of people ask this. Can you please go over the websites people can find stuff on?
Yes.
Because people are asking,
Yes.
I want that program, I want that program.
So the website is that we have the Save Your Brain program, and basically my website with all our articles, and we have a newsletter, is Dr. K News, drknews.com, Dr. K News. If you go on that, you'll see the online programs we have. We have one for the brain, we have one for immune tolerance, and we're hoping to add other programs early next year. So that's Dr. K News, and then this is our Facebook page. If you just follow us, then you'll be up to date whenever we do talks and all the information that we have available on Facebook.
The FNS.
And then for the neurology course, it's Functional Neurology Seminars. That's functionalneurologyseminars.com. If you're a healthcare professional, want to go into a deep dive of neurology and rehabilitation. And then if you're interested in functional medicine and you're a healthcare professional and you want to learn postgraduate courses on nutrition and diet, nutrition, lifestyle applications, and diagnostic testing to manage patients, then we have a website called Kharrazian Institute. And obviously my last name is very difficult to spell. Kharrazin Institute.
I-A-N.
Kharrazin Institute.com.
Sorry. Susan just said, please mention she posted all the stuff in the comments.
Susan posted everything. Thank you.
Thank you, Susan.
All right. Thank you all. I hope you found some information useful here, and thank you for your time. And please join our community and share these talks. And thank you for all your support and help. And we'll be back next week with a new topic. Thank you.
Yay.